Ready?
Yeah.
Okay. Hello, everybody. Dr. Darryl Boston's with Barry Chiropractic.
Hello, and I'm Dr. Lorne.
Today, we want to tell you a little bit about some new furniture that we have in the treatment rooms that perhaps you've noticed over the last little bit. These are called wobble chairs, and we would like to start to use these wobble chairs as a means to prepare your body for your adjustment. There's lots of benefits of these wobble chairs. Basically, they're like a big exercise ball. And so if you sit on them, they're pretty unstable. So it forces your core muscles to engage to try to maintain balance, which of course is good for lower back and spinal stability. So be careful about sitting on them because we don't want you to sit and go for a spill. So we're going to demonstrate how these things are used. They're both similar. They look a little bit different, but they do the same sort of thing. What we want you to do is to get in the habit of coming in the treatment room while you're waiting for us and sitting on these wobble chairs and performing a few activities within your comfort level as an effort to prepare you for the adjustments.
So the very first thing you're going to want to do when you go to sit on these chairs is always put your hands on the handles first, because as you're going to see, this moves all different ways. So if you're not holding on, you're going to fall back, hit your head or something like that. So always keep your hands on the handles if you can. The first exercise you're going to do is you're going to go left and right. You're just going to move sideways, back and forth. And what we're doing here is just getting more mobility in the spine, but it's also been shown in research that will increase the height of the disc. So the first stage of degeneration is the spine starts to degenerate and the disc starts to dehydrate. So this is getting nutrients back to the disc. But as Dr. Darryl was saying, it also gets mobility. So it makes it easier for when we adjust you as well. So you're going sideways. The next one you're going to do is you're going to go forwards and backwards. So just like that, coming forwards and backwards. And remember, you're trying to get the pelvis going. It's not just moving forwards and backwards. So it's really rocking your pelvis is what you're trying to get. And the last one is you're going to do circles, just like a hula hoop. So you're going to go both ways, just like that. And again, it's great for you to do this while you're waiting for us, and it's only going to benefit you. So please do it, but be safe when you do sit on these. And that would be about it.
Right, and so the other chair is very similar. It's the same idea, and just to sort of show you, when you sit on it, the chair is free, so it'll wobble away on you. Same with this one. And for this one, the point goes forward.
Yes.
Yeah,
Yes.
and this one, it doesn't really matter. But when you do sit on it, it'll wobble pretty good, so be careful when you do it. Okay, so good luck. If you have any questions, don't be afraid to ask, but we would really like to see everybody starting to use these things as a warm-up sort of thing before their adjustments. Thanks, everybody. Talk to you
Thanks a
soon.
lot.